It'll be all right. Come in. Hi. Charlotte, is that right? Hi, I'm Dr. Rose.
Nice to meet you.
Hi. This is Laura. She's a healthcare assistant who gives us a hand. So...
Time for the coil.
You're looking forward to it.
Dreading it. Yeah. I know it hurts.
Because you've had it done before, haven't you?
Yeah.
You're keen to do the same thing again.
Yeah, although it hurts for the first... I found for 2 weeks afterwards. Then for 5 years it's absolutely fine. So it seems like the best option of a lot of them.
So this is the coil that we're fitting. So this is what it sort of looks like. Basically what we do is I'll use the speculum, which is the thing that opens up your vagina so we can see your cervix. And then what I'll do is I'll remove the coil that's there at the moment. Okay. We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb.
Someone told me their friend was born with their friend's baby was born with a coil on their head.
Yeah, it does happen.
I've heard of something.
The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb, there's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This
Have
is
you
never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away.
Okay. Yeah. Hello. Register baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you, Ali Hassas. Come on through. Grab a seat. Grab a seat. Right. How can I help?
Mischa is now 11 days and totally healthy from day one. Gained weight from day one on. So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? He's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes.
Feeding okay?
Yes. He never lost any weight, even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And
quiet,
he's like...
Should we have a look? Is that okay?
Yes.
Can you unpop him?
Yes.
And just roll this up. Now, can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but...
Okay. Let me have a listen before he starts crying. Because it's not... Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold?
Just bear with me 1 second. Let me just have a good listen.
Kate, isn't it? Have a seat, Kate. I'm Louise, one of the nurses. Rightio, you're here for your pill this morning.
I just need a repeat prescription for my pill, actually.
Okay. I just need a repeat for my pill.
Just looking to go back on the pill again. Have you had thought about any other types of contraception?
I have. It's just, at the moment, I'm just carrying on this.
I did my test, pregnancy test, and it came that I'm pregnant. Because I was on mini pill, so, you know.
So you weren't planning on getting pregnant?
Not really.
No.
You all right?
Yeah. Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coil.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in, okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Sorry, do you mind if I hold you?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah.
So we're going to take the coil out, okay?
So a nice big cough for me.
Cough. There
Okay.
we go.
Is it out?
Yeah,
Yep.
that's out. You all right?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp.
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah.
Yep.
So this is the coil going in now,
Okay.
okay?
You all right?
Is it in?
Yep.
You've done really well.
I
So
haven't.
you're.
I know I haven't.
You have. You've done amazingly.
I was practically crying. I think that's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it. Just
Thank
sit
you for
there
holding
for a
my hand.
moment. That's all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't.
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like.
Just like, yeah, just needle me, just chop me open. I don't care. There's no point. It's like my boobs are good as they are.
It's exciting.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs, and his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. Yeah. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that. We put it
around in the bedroom. Perfect. That will be useful. And you can get. I mean, there's very little at the moment for. Saline sprays, but you can get sprays for the nose that helps from the pharmacy that helps clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were.
Yeah.
Or he's still not as alert, or things are not improving. Or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. Okay. All right,
Bye-bye.
Take care now. Bye-bye.